Hello, Untamed TV fans. It's Craig Bielik, your host, as usual. I do a lot of these. I know what you're saying, too many of them, that's for sure. And today we are joined by
Dr. Lance Bryce
from
Brigham City Community Hospital.
And we're going to talk about
hemorrhoids.
I didn't want to say it. I just didn't want to say it.
Come
so
on.
did you see how I did that?
You don't want to touch that?
I don't want to touch that,
Okay.
literally.
All right.
I don't want to
Neither
touch that.
do I usually.
I know a lot of you are getting ready to tune out, but don't, okay? Because this is important, okay? Hemorrhoids, like a lot of medical things, exist. And we wish they didn't, and we don't like to talk about them, but, you know, for heaven's sakes, they do. And so let's talk about it. I you know what? I don't even know if I know exactly what a hemorrhoid is. What is a hemorrhoid?
So hemorrhoid is basically the name given to the vein that is around your bottom.
Okay.
And they're designed to be a cushion.
Okay.
That's their lot in life.
That's their job.
That's their job.
Cushion. So when you get kicked in the butt by your coach or whatever, the hemorrhoid is there for you. I'm there for you, buddy.
Hopefully your gluteal muscles will block that blow, but what we're talking about is when you have a bowel movement, it's what allows that area to expand without ripping or tearing or things like that. Because they're veins, they can stretch. Unlike an artery which has a muscle on it, they don't stretch very well.
Okay.
And so that's their purpose. And it's the number one disease process in the entire world. 40% of all people on the face of the earth will seek some sort of medical attention for hemorrhoids.
Are you serious?
Yep.
Like that common?
That common.
That common. So almost half of us. Almost half of us.
Yeah. Most people, when I talk to them about this, are like, oh, I'm so embarrassed about this, or we're talking about this, and I'm like, I dare you to just bring it up in the next conversation where there's 5 or more people,
right, and
somebody else will talk about their hemorrhoids.
Right. So you set the hemorrhoid up like it's a good thing, but it's always referred to as kind of a bad thing. So what happens? What's the disease process? What goes wrong?
So basically what happens is those veins will get stretched beyond their elasticity, and then they fill up with blood. And around that area, there are branches that come down from what's called a superior rectal artery. And you can think of those arteries as like a high-pressure fire hose filling up low-pressure garden hoses.
Oh.
And that's literally the way to think about it. And so these veins just get pounded, and pretty soon they stretch out, and they either rupture and bleed. They get a blood clot in them, which is very painful if they're on the outside. As far as, who gets them, women and men get them. Women usually get them during childbirth, and then constipation, heavy lifting. And men, we have heavy lifting and constipation, obviously because we don't birth children. But otherwise, I think it would be equal for both of us if we did. So.
Right. So the fire hose, the garden hose gets full from the fire hose.
From the fire hose.
And of course, like it would, it starts to protest a little bit.
It does.
And then after time, it protests more and more and more.
And it lets you know.
And it gets pressure. And it lets you know how. I mean, it hurts.
Well, if it's on the outside. If it's on the inside, that's going to be your itchy, kind of bleeding occasionally. Just a sensation like I feel like I got to go to the bathroom, but I just can't. There's nothing there. I sit for hours, which makes them worse, actually. And they feel like they've got to evacuate their bowels, but they can't. But it's just the sensation of those enlarged veins down there.
On that.
Yeah, but the inside ones don't hurt. And what determines internal from external is as the skin comes in, it meets the lining of the colon, and that's your demarcation mark. So if they're on this side, they're internal. If they're out here, they're external.
Okay. So 2 different kinds and 2 different sets of symptoms, although similar.
They are the same type of vein. It's just based off location.
On where it's location. Okay. So how do you know when it's time to do something about it? I mean, you say pretty much everybody's got them. Some people live them whole life. Some people don't live very long with them. Or
depends. The next baby that's born on Earth will come with hemorrhoids. So
really? Whether
they become symptomatic, 40% chance. Most people will come to me by the time they get to me or their primary care doc. They'll say, Doc, I used some hemorrhoid cream, or I used some suppositories, or I looked online and found some home remedies, and nothing's working.
Okay.
I'm bleeding. These are itching, or if they're on the outside, they're painful. Most people don't wait for those. They can hardly even sit down.
Oh.
They're easy patients to diagnose because when I walk in the room, they won't sit down.
Yeah.
That's how painful.
Have a seat. No, thank you.
No, they won't, and,
Yeah,
and you can't talk them into sitting down.
Yeah.
It's horrible.
Yeah. So they know.
There's
They know
there is no doubt.
And there are some home remedies. There are some over-the-counter things that you can do, and you should try those
Try
probably
them.
first.
Absolutely. I do not disagree with trying everything but surgery first.
Okay.
I think it's a good peace of mind where you don't feel like, well, I gave up too early, or I don't know, is surgery right for me? Well, go through the conservative things. Go through easy things to try. Maybe they will work.
Mm-hmm.
And if they do, you don't need me. And if they don't, we'll take care of them.
You need me. Okay.
Yeah.
So they don't. So you get to the point where it doesn't. What happens next? What's the next? How's this process work out? What's the surgery like?
So basically, they come in for an evaluation. When I do the exam in my clinic, I try not to have the patient get too uncomfortable. Obviously, it's a private part of the body, and no one really wants to talk about it. So I just tell them, I just want to see what I can see on the outside. I'm not going to probe on the inside or anything. Mm-hmm. That will be at the time of surgery. So if I listen to their story and I don't see anything on the outside, then I know we've got internal hemorrhoids and we know which way to go. If I have them come in and I see the hemorrhoids and they're painful and red, then I also know which direction we need to go. So
is it possible to have both?
Yes.
Oh, okay.
Absolutely. Yep. And they have different grades, so anywhere to just a little minor grade thing, which might be a little bump, all the way up to grade 4, which basically looks like a big cauliflower coming out of your bottom.
Wow.
Wow.
So then they have surgery, and obviously surgery means you go in and remove them, you cut them out, basically.
We cut external ones out. We don't necessarily have to cut them out anymore on the internal ones. So we used to do rubber banding. That was kind of an early technique. It worked pretty good. The problem is it only treated that hemorrhoid.
Oh.
And that hemorrhoid was theoretically the weakest hemorrhoid of the bunch, and that's why it got stretched out. So we take care of that one, and then when's the next one going to pop up? We don't know. 2 days later, 2 weeks later, 20 years later, never. So we would only treat the hemorrhoid. Well, lots of patients coming back for lots of bandings. Not fun. And they're kind of looking at us like, are you ever going to fix my problem, doc?
Right.
So there's a couple of ways to take care of them. One's called a heat energy transfer procedure. So after you're asleep and we know you're 100% comfortable, then we use a little speculum that goes in, and it has a little trap door in it. And when you open up that trap door, the hemorrhoid pops up in between, and there's 2 metal plates, and we just squeeze that plate, and then we use cautery, and we just shrivel that hemorrhoid up.
Okay.
And then there's another one called a THD procedure, transanal hemorrhoidal dearterialization procedure. Great YouTube video that you can look up and watch.
Look that up.
You can actually watch
interesting.
it. Turn up your volume because it'll show you the ultrasound part of this. This one's a little more comprehensive because I told you earlier that there's these fire hoses that come down that hook into the garden hoses. What we do with this one is we use ultrasound to get to the tip of the fire hose, and then we throw our stitch and basically shut the tip of that fire hose off so that it can't pound into the garden hoses.
Wow.
And then we grab all the excess tissue that's poking out or protruding, and we just grab that and we stitch it and put it back into place. So hemorrhoid surgery is literally the most non-glamorous surgery that I can think of, okay? Except with these procedures, when we go through and we take care of these hemorrhoids, you can actually take this cauliflower and make it look almost natural by the time you're done. And what that does is we don't have to do any slicing or cutting or stitching or any of those kind of things on the outside where it's very painful. And you actually get somewhat of a, I'll use the word cosmetic, get somewhat of a cosmetic look where it starts to look more normal right after you're done with the procedure.
Really?
Whereas it used to take 8 or 12 weeks for all the swelling to get down. And then, did we leave too much skin? Did we not take enough skin? There's skin tags left over, and then it's really hard to clean down there.
Sure.
But So it's
Sure.
kind of glamorized, the hemorrhoid
Well, you say
operation.
it's not glamorous, but I would imagine that somebody in that much pain probably comes to you a few weeks later and says, "Man,
they-
you changed my life."
They love me.
yeah, I
Yeah,
was
they
gonna
absolutely
say-
love me. Yeah,
Yeah.
it's life changing because it's life limiting. Before that, they don't travel far. They may not go to church anymore. They may not go to movies. They may not do anything. It's lifestyle limiting for sure.
It's really hard.
And you can kind of give them their life back.
It sounds like there's various procedures, but what's recovery like, generally speaking?
So, depending on which one we use, the heat procedure, THD procedure, what I do is I make them clean out like they're going to have a colonoscopy.
Okay.
Because I think the worst thing for them to do is to get one of these procedures, which is going to cause a little swelling anyway.
Mm-hmm.
Surgical procedures do that. And then try and go to the restroom after that.
Mm-hmm.
And so what I tell them is, if you can slurp it through a straw, if you can melt it in your mouth, I want you to go as far down the road as you can doing those two things
Sure.
before you absolutely have to have something solid to eat,
Right.
or you're just going to take somebody out.
Right.
So they get hangry, I think is the term that's used out there, and they're like, if I don't have some solid food, someone's going to die,
Right.
But I tell them just go as far as you can with that, because then that gives that a chance to the swelling to go down, and they don't have any pain or discomfort for the most part. When we do external hemorrhoids, the patient talks me into doing the external hemorrhoid.
Is that right?
It's that painful.
It's begging, huh?
Yeah,
You do a lot of these?
I do.
Really?
I had a 17 patient clinic on Monday and saw 3 patients for
Wow.
hemorrhoids. So
Wow.
number 1 disease process in the world.
Yeah, so here's the thing. If you're out there, if you're sitting out there watching TV, or if you're not sitting on purpose
Yeah.
watching us right now, you're not alone. And it's not embarrassing. And that's what doctors are here for, and help is available.
For sure.
Try the home remedies, but when
Yep.
they don't work, give Dr. Bryce a call. You can find information at brighamcityhospital.com. You can call Dr. Bryce, look him up online, look him up in the phone book, smoke signal, whatever. He'll respond. He will respond, and he can help you. Don't be embarrassed. Get it done. Get it taken care of, and start living your life again. Sit down for a change.
For sure. We'll give you your life back for sure.
Give you your life back on that sort of thing. I can't even imagine. I mean, it's probably like, even a drive to Salt Lake or something like that's terrible.
They won't go to Salt Lake.
Really?
Especially if they have external hemorrhoids, they can't sit down that long.
Oh, mercy.
Yeah, it's terrible. They can't go to kids' concert, grandkids' concert. I mean, it's just too much time.
Right.
So
Dr. Bryce can help you. So don't put up with it. Get it taken care of. Thank you, Dr. Bryce, for joining us today on Untamed TV. If you never thought this was Untamed TV, by goodness, today's subject will probably prove that we are untamed all the way through. Craig Bielik, your host, please join us again.
Untamed TV. Untamed. Untamed.